You reheated last night's dinner, sat down with your family, and felt good about not wasting food. It seemed like a perfectly responsible choice. But what if I told you that simple act, something you probably do several times a week, might be silently weakening your bones with every bite? What if the leftovers sitting in your refrigerator right now are slowly stealing calcium from your skeleton, making your bones more fragile, more prone to fractures, more vulnerable to osteoporosis? I know this sounds alarming, and honestly, when I first started connecting the dots between certain reheated foods and the bone density issues I was seeing in my patients, I was skeptical too. But after 23 years of practicing internal medicine and seeing thousands of patients with unexplained bone loss, I can no longer ignore what the evidence keeps showing me. There's something happening in our kitchens that most doctors aren't talking about, and I believe you deserve to know. My name is Dr. Sophia Reynolds, and I specialize in metabolic health and bone disorders. Over the past 2 decades, I've helped countless patients understand why their bones were weakening despite doing everything right. Taking their calcium supplements, exercising regularly, getting enough vitamin D. And time after time, when we dug deeper into their daily habits, we found something surprising lurking in their kitchens. Something that seemed completely harmless, but was actually undermining all their efforts to stay strong and healthy. Before we dive into this information that could genuinely change how you think about your meals, I want to ask you something. If you haven't subscribed to this channel yet, I recommend hitting that subscribe button and turning on notifications so you never miss another health tip made especially for you. And if you find this video helpful, please send your video suggestions and questions in the comments. I read every single one, and it helps me create more content to help more people just like you. Now, let me tell you about Margaret. She was 71 years old, a retired schoolteacher from Portland, Oregon, the kind of woman who did everything by the book. She walked 3 miles every morning, rain or shine, took her calcium religiously with breakfast and dinner, ate what she thought was a healthy diet full of vegetables and lean proteins, and had never smoked a single cigarette in her entire life. Her mother had lived to 94 with strong bones, so Margaret assumed she had good genetics on her side. So when she came to see me after fracturing her hip from a simple fall in her kitchen, she was devastated and confused. Her bone density scan showed severe osteoporosis, and she kept asking me the same question over and over. How did this happen? I did everything right. As we went through her daily routine, something caught my attention. Margaret was incredibly proud of her meal preparation habits. Every Sunday, she would cook large batches of food and reheat them throughout the week. I hate wasting food, she told me, and it saves so much time. At my age, I don't want to spend hours in the kitchen every day. She had been doing this for over 15 years, ever since her husband passed away, and cooking for one seemed pointless. What Margaret didn't know, and what most people don't realize, is that certain foods undergo significant chemical changes when reheated. These changes can affect how your body absorbs nutrients, how minerals interact with your digestive system, and ultimately how strong or weak your bones become. Let me explain the science in simple terms, because I think everyone deserves to understand what's happening in their own body. When you cook food, you're using heat to break down and rearrange molecules. Proteins change shape, starches gelatinize, and various compounds interact in new ways. This is why cooked food tastes and feels different from raw food. But here's what most people miss. When you cool that food down and then reheat it, you're not just warming it up again. You're triggering a second round of chemical reactions. And in some cases, a third round if you reheat it again. Some of these reactions are harmless, but others create compounds that can interfere with calcium absorption, promote inflammation throughout your body, and actually pull minerals out of your bones to neutralize acids. The first food I need to warn you about is one that probably surprised me the most when I started researching this: spinach. Yes, spinach, that superfood we've been told to eat more of since we were children watching cartoons about strong sailors. Now, let me be very clear because I don't want any misunderstanding. Fresh spinach and properly cooked spinach eaten immediately are wonderful for your health. Spinach contains calcium, magnesium, vitamin K, iron, and other nutrients that support bone health and overall well-being. But when spinach is reheated, something problematic happens at the molecular level. Spinach is naturally high in compounds called oxalates. These are organic acids that plants produce for various biological reasons. When spinach is first cooked, some of these oxalates bind with the calcium in the spinach itself, which reduces how much calcium you absorb. That's already not ideal, but your body can still get some benefit from the other nutrients present. However, when you refrigerate and reheat spinach, the oxalate concentration actually increases because the water content decreases through evaporation, while the oxalates remain concentrated. More importantly, these oxalates become more reactive after the cooling and reheating process. They don't just bind with the calcium in the spinach anymore. They can bind with calcium from other foods you're eating at the same meal and even pull calcium from your bloodstream, which your body then has to replace by taking it from your bones. I had a patient named William, 78 years old, a former accountant from Chicago who prided himself on his healthy habits. William loved his green smoothies and had been drinking them every morning for about 8 years. He would make a big batch of cooked spinach at the beginning of each week, refrigerate it in portion containers, and then add reheated portions to his daily smoothies along with banana, protein powder, and almond milk. He thought he was being incredibly healthy and giving his bones everything they needed. When his bone density test came back showing significant decline over just 2 years, a decline that couldn't be explained by his age alone, we were both puzzled. William was doing so many things right. He exercised, he didn't smoke, he limited his alcohol intake. But when we eliminated the reheated spinach and switched to fresh greens or raw baby spinach, his next scan showed his bone loss had stabilized. His body was finally able to hold on to the calcium it needed instead of having it bound up and excreted. If you're still watching and finding this information useful, drop a comment below to let me know you're with me. Your engagement helps this video reach more people who need to hear this information. The second food that concerns me deeply is rice. I know rice seems so innocent, so basic. It's a staple in cultures around the world, and billions of people eat it every day without apparent problems. But reheated rice presents a specific challenge for bone health that most people have never heard of, even from their own doctors. When rice is cooked, the starch granules absorb water and expand significantly. This is why cooked rice is fluffy and soft. When it cools down in your refrigerator, that starch undergoes a process called retrogradation. The starch molecules reorganize themselves into tighter, more crystalline structures. This process continues the longer the rice sits in your refrigerator. When you reheat that rice, these retrograded starches become what scientists call resistant starch. Now, resistant starch isn't all bad. In fact, it can be good for gut health in some ways because it feeds beneficial bacteria in your colon. But here's the problem for your bones. Resistant starch can bind with minerals in your digestive tract, including calcium, magnesium, and zinc, all of which are essential for bone health. This binding reduces how much of these minerals your body can absorb from your entire meal, not just from the rice itself. But there's another issue with reheated rice that's even more concerning. Rice can harbor spores of a bacterium called Bacillus cereus that produces toxins when rice is improperly cooled or stored. These toxins, even in small amounts that don't cause obvious food poisoning, promote inflammation in the body. And chronic low-grade inflammation is one of the biggest enemies of bone health that most people don't know about. Inflammation activates cells called osteoclasts, which break down bone tissue. At the same time, it inhibits osteoblasts, the cells that build new bone. So you end up with more bone being destroyed and less being rebuilt, a recipe for weakness and fractures. I remember Dorothy, a lovely 69-year-old woman from San Antonio who worked as a librarian for 40 years before retiring. Dorothy was meticulous about everything, including her meal prep. She would cook a large pot of rice every Monday, enough for the whole week, and eat portions of it reheated with different proteins and vegetables throughout the week. It was efficient and economical, and she never thought twice about it. She developed persistent digestive issues in her late 60s that she attributed to getting older. Just part of aging, she assumed. But she also started experiencing unexplained bone pain in her legs and back, a deep ache that would come and go. When we tested her bone density, it had declined significantly more than expected for her age. We also found signs of chronic low-grade inflammation in her blood work. Once we changed her habits around rice, preparing smaller, fresh batches every 2 or 3 days instead of reheating week-old rice, her inflammation markers improved, her digestion got better, and her bone density decline slowed considerably over the following year. Now, the third food might be the most controversial, because it's something almost everyone reheats without a second thought. Chicken. Poultry that has been cooked, refrigerated, and reheated undergoes protein degradation that can have significant effects on your body, including your bones. When chicken is first cooked, the proteins denature, which means they unfold and change shape. This is normal and actually makes the protein easier to digest and absorb. But when chicken cools down and is then reheated, especially multiple times or at high temperatures like in a microwave, those proteins continue to break down in ways that aren't beneficial. They can form compounds that are harder for your body to process, and that can promote oxidative stress throughout your system. Oxidative stress is like rust forming inside your body. It damages cells, including the cells responsible for maintaining your bones. Your body has natural defenses against oxidative stress, but when the stress is chronic, day after day from dietary sources, it overwhelms your defenses and shifts the balance of bone remodeling toward breakdown rather than building. Your skeleton becomes weaker over time, even if you're getting plenty of calcium and vitamin D. There's also the issue of advanced glycation end products, which some researchers abbreviate as AGEs. These compounds form when proteins are heated, and they form in greater amounts when proteins are reheated. AGEs accumulate in tissues throughout your body, including bone tissue, where they make the collagen matrix more brittle and less flexible. Healthy bones need to be slightly flexible to absorb impact without breaking. Think about how a young green branch bends without snapping, while an old dry branch breaks easily. When AGEs accumulate in your bones, they become more like that dry branch, rigid, and more likely to fracture under stress that healthy bones would easily withstand. Henry was 74, a retired postal worker from Denver who prided himself on his practical approach to life. Every Sunday, he would roast 2 whole chickens and eat the reheated meat throughout the week in various forms: sandwiches for lunch, stir-fries for dinner, chicken salad when he was feeling fancy. It was economical, it was convenient, and he thought it was healthy since he was eating lean protein instead of red meat. But Henry started noticing that his joints ached more than they used to, especially in the mornings. He blamed it on old age and the Colorado winters. Then, one icy day, he slipped on the sidewalk and fell on his outstretched arm. He fractured his wrist in a way that surprised even his orthopedic surgeon. The bone just seemed to shatter, the doctor told him. I would have expected a cleaner break from a fall like that. That brittleness, that shattering quality, is exactly what happens when AGEs accumulate in bone tissue over years. We worked together to change Henry's meal prep habits, cooking smaller amounts of chicken more frequently, and while we couldn't undo years of accumulated AGEs overnight, we could stop adding more and give his bones a chance to rebuild with healthier collagen. But if you think that's concerning, wait until you hear about the fourth food, because this one is sitting in almost everyone's refrigerator right now. I'm talking about potatoes. Potatoes are complex carbohydrates that undergo dramatic changes when heated, cooled, and reheated. Like rice, potatoes develop resistant starch when cooled, and this resistant starch increases even further with reheating. But potatoes have an additional concern that rice doesn't. They're part of the nightshade family of plants, which means they contain compounds called glycoalkaloids, specifically solanine and chaconine. In fresh, properly stored potatoes kept in cool, dark conditions, glycoalkaloid levels are usually low enough to be perfectly safe. But when potatoes are cooked, refrigerated, and especially when they're reheated, glycoalkaloid concentrations can increase, particularly if the potatoes were stored in light or started developing green spots before cooking. Glycoalkaloids can affect calcium metabolism by interfering with how your intestines absorb this crucial mineral. They can also promote low-level inflammation in the gut lining, which creates a cascade of effects throughout your body, including in your bones. I'll never forget Patricia, a 67-year-old grandmother from Minneapolis who made the best mashed potatoes her family had ever tasted. It was her specialty, her signature dish that everyone requested at every family gathering. She would make huge batches for family dinners on Sundays and then eat the leftovers, reheated in the microwave for days afterward. Sometimes those potatoes would last her until Thursday or Friday. Patricia came to me complaining of muscle cramps and weakness, particularly in her calves at night. These symptoms can be signs of calcium deficiency even when dietary intake seems adequate. Her bone density was declining faster than expected for her age, and she had already experienced 2 stress fractures in her feet just from walking around her neighborhood, something that should never happen from normal walking. When we examined her diet carefully, those reheated potatoes stood out as a major factor. She was essentially blocking a significant portion of her calcium absorption several times a week without knowing it. Once we addressed this, her cramps improved within weeks, and her bone density decline slowed significantly. If you're learning something new right now, I'd love to know. Leave a comment below with your thoughts, and don't forget to share this video with someone you care about who needs to hear this information. Knowledge shared is health preserved. The 5th and final food I need to warn you about is perhaps the most consumed reheated food in America: pizza. And before you say anything, I know how convenient it is to grab a cold slice from the fridge, pop it in the microwave or oven, and have a quick meal. I've done it myself more times than I care to admit during busy years of medical residency and building my practice. But understanding what happens to pizza when it's reheated has genuinely changed my habits, and I think it might change yours too. Pizza combines several problematic elements when reheated, creating what I think of as a perfect storm. You have the wheat crust, which, like other starches, develops resistant starch when cooled and reheated. You have cheese, which is high in saturated fat that can become oxidized when reheated, and oxidized fats promote inflammation throughout your body. You often have processed meats like pepperoni or sausage, which form additional harmful compounds when reheated, including heterocyclic amines. And the tomato sauce, while healthy when fresh, because it contains lycopene and other beneficial compounds, can see those beneficial compounds degraded by the reheating process while the acidic nature concentrates. But here's what really concerns me about reheated pizza from a bone health perspective. The combination of high sodium from the cheese and processed toppings, the resistant starch from the crust, and the inflammatory effects of oxidized fats creates what I call a perfect storm for calcium loss. High sodium intake alone causes your body to excrete more calcium through urine. Your kidneys simply pull more calcium out to balance the sodium. Add in the mineral-binding effects of resistant starch and the bone-destroying effects of inflammation, and you're looking at a food that actively works against your bone health on multiple fronts simultaneously. I treated a patient named Robert, 72 years old, a retired engineer from Seattle who was a self-proclaimed pizza enthusiast. He had a favorite pizzeria on speed dial and would order 2 large pizzas every Friday night, a tradition he'd maintained for decades. Robert would eat a few slices fresh that evening, refrigerate the rest, and then reheat portions throughout the following week. Sometimes he would reheat the same slice multiple times if he got interrupted and didn't finish it. By his count, he was eating reheated pizza at least 4 or 5 times per week. Robert was shocked when I showed him his bone density results. At 72, he had the bone density of someone in their mid-80s, despite being otherwise healthy and active. He still played golf twice a week and walked his dog daily. He had no family history of osteoporosis, no other obvious risk factors. But those reheated pizzas, eaten week after week for decades, had taken a real toll on his skeleton. When we changed his habits, limiting pizza to once a week eaten fresh and eliminating the reheating habit entirely, His bone loss slowed dramatically within a year. Now, I want to be very clear about something, because I don't want to create unnecessary fear or make you feel like you can never enjoy leftovers again. The occasional reheated meal is not going to destroy your bones. The human body is remarkably resilient, and it can handle occasional stressors without long-term damage. Our ancestors survived all kinds of dietary challenges, and our bodies have evolved to be adaptable. What concerns me, and what I see causing real problems in my patients day after day in my clinic, is the habitual, regular consumption of certain reheated foods over months and years and decades. The damage is cumulative. It's not dramatic. You won't feel your bones getting weaker from one reheated meal. There's no sudden pain or obvious symptom. But over time, if you're consistently eating these foods in their reheated form, you're creating conditions that favor bone loss rather than bone building. You're tipping the balance in the wrong direction, slowly but persistently. And by the time you notice a problem, by the time you get that bone density scan showing osteopenia or osteoporosis, or experience that unexpected fracture from a minor fall, significant damage has already been done. Bones take years to rebuild, but they can be weakened much faster than most people realize. So, what can you do with this information? Let me give you some practical strategies that have helped my patients protect their bone health without completely giving up the convenience of meal preparation. First, when it comes to leafy greens like spinach, try to eat them fresh or enjoy them immediately after cooking. If you want to incorporate greens into meal prep, consider alternatives like fresh arugula, raw baby spinach in salads, or lettuce varieties that don't need to be cooked at all. If you do cook greens, try to consume them within a few hours, rather than refrigerating and reheating them the next day or later in the week. For rice, the safest approach is to cook what you need for one meal or one day at most. If you do make extra, cool it quickly by spreading it in a thin layer, refrigerate it properly within an hour of cooking, and try to use it within 24 hours, reheating it only once and making sure it's steaming hot all the way through. Even better, consider swapping reheated rice for freshly prepared alternatives like quinoa, couscous, or cauliflower rice, which don't have the same issues with resistant starch and bacterial concerns. With chicken and other poultry, try to plan your meals so you're eating freshly cooked protein most of the time. If you do have leftover chicken, consider eating it cold in a salad rather than reheating it, which actually preserves more of the protein quality. When you do reheat poultry, do it gently at lower temperatures and only once. Avoid the common habit of reheating chicken multiple times throughout the week, or using high microwave settings that accelerate protein degradation. For potatoes, the same principle applies. Fresh is best. If you're going to have leftover potatoes, refrigerate them quickly. Use them within a day or two maximum, and consider preparation methods that minimize the issues. For instance, roasted potato wedges tend to retain their structure better than mashed potatoes when cooled and reheated, and the firmer texture means less surface area for problematic changes to occur. And pizza? I hate to say it, but the best approach is to either eat it fresh the same evening you order it, or accept that cold pizza the next morning might actually be healthier than reheating it. If you must reheat pizza, do it once only, in the oven rather than the microwave to avoid uneven heating and excess moisture, and try to limit how often you're eating reheated pizza overall. Maybe consider making Friday pizza night truly special by only eating it fresh. I also want to emphasize that these changes work best as part of an overall approach to bone health. Continue taking your calcium and vitamin D as recommended by your doctor. Continue doing weight-bearing exercise like walking, dancing, or light weights, which stimulates bone building through mechanical stress. Continue getting regular bone density screenings, especially if you're over 65 or have other risk factors like family history, previous fractures, or long-term medication use. The changes we've discussed today are about removing obstacles to good bone health, not replacing the fundamentals. Let me share one more story with you, because I think it illustrates how powerful these changes can be when combined with other healthy habits. Eleanor was 75 when she first came to see me, referred by her primary care doctor who was worried about her declining bone density. She had already been diagnosed with osteoporosis and had suffered 2 vertebral compression fractures that had shortened her height by almost 2 inches and left her with chronic back pain. She was terrified of breaking more bones, and she felt helpless, like her body was betraying her despite her best efforts. When we went through her habits, we found that she was doing many things right, but was unknowingly sabotaging herself with her meal prep routine. She was reheating spinach and her morning eggs, rice with her lunch, chicken for dinner, and potatoes several times a week. She had been doing this for years, believing she was being healthy and practical. We made a plan together to shift toward fresher foods, while still being realistic about her time and energy. Small changes, implemented gradually, that she could maintain long-term. 2 years later, Eleanor's follow-up bone density scan showed something remarkable. Her bone loss had not just slowed, it had actually stabilized in most areas and showed slight improvement in her spine and hip. She hadn't had any new fractures. Her back pain had decreased and she was walking more confidently. And she told me something that stuck with me. I used to feel like I was fighting my own body. Now I feel like I'm working with it, like we're on the same team again. That's really what this is all about. Understanding how the foods we eat and how we prepare them can either support our bodies or work against them. Your bones are constantly remodeling, constantly breaking down old bone and building new bone in a process that continues throughout your entire life. When you eat in ways that support this process, your skeleton stays strong and resilient. When you eat in ways that interfere with this process, even unknowingly, you create conditions for weakness and fragility. I want you to feel empowered, not frightened, by this information. Knowledge is power, and now you have knowledge that most people, even most doctors, don't routinely discuss. Now that you understand how reheating certain foods can affect your bones, you can make informed choices. You don't have to be perfect. You don't have to give up leftovers entirely, or spend hours cooking every day. You just need to be thoughtful about which foods you reheat and how often, making small adjustments that add up to big benefits over time. Your bones are the foundation that carries you through life. They support every step you take, every hug you give your grandchildren, every moment you spend with the people you love. Taking care of them isn't about deprivation or fear or constant worry. It's about respect for the incredible structure that makes your life possible, and about making choices that honor that structure. Before we finish, I want to remind you that while this information is based on clinical experience and scientific understanding, it's not a substitute for personalized medical advice. Everyone's situation is different, and what works for one person may need to be adjusted for another. If you're concerned about your bone health, please talk to your own doctor. Get a bone density scan if you haven't had one recently. Discuss your diet and lifestyle with a healthcare provider who knows your individual situation and can give you personalized recommendations. If you found this video helpful, please share it with someone you care about. Your mother, your grandmother, your neighbor, your friend from church, anyone over 60 who might benefit from understanding how their food preparation habits could be affecting their bones. A simple share could prevent a devastating fracture for someone you love. And if you have questions or want to share your own experiences, please leave a comment below. I read every single one, and your stories often inspire future videos that help even more people. Your engagement makes a real difference in spreading this important information. Take care of yourself, take care of your bones, and I'll see you in the next video.